So your doctor schedules a routine screening. You go, you do it, you probably don't even think twice about it, right? But what if I told you that some of those checkups, especially as we get older, might actually be more likely to hurt you than to help you? Okay, let's really dive into this, because what we're about to cover could completely change how you approach your own healthcare.
It's a pretty unsettling question. I get it. We've all been taught our whole lives that more tests, more screening, that equals better health. But it turns out, for those of us over 60, and especially over 70, the science is starting to paint a very, very different picture.
And look, this isn't just my opinion. That's a quote from Dr. James Harove, a specialist in geriatrics who's been at this for 30 years. He's seen firsthand how a system that's designed to protect us can sometimes lead us down a really dangerous path. And his whole philosophy is built on one crucial idea we all need to understand.
He calls it screening math, and it's really simple. The whole risk versus benefit equation for medical tests, it's not set in stone. It changes, and it changes dramatically as we get older. A test that makes perfect sense when you're 50 can become a really risky bet when you're 75. And a big reason for that is something called the cascade effect.
Now, the idea itself is simple, but wow, the consequences can be huge. It's like a snowball rolling downhill. It starts with one single routine test. Maybe it shows a tiny little abnormality. Well, that triggers a follow-up test, which leads to a biopsy, which then leads to a procedure. And all of a sudden, a person who felt perfectly fine is swept up in this cascade of medical interventions, and every single step has its own risks.
And when you put it side by side, the difference is it's night and day. At 50, yeah, your body is more resilient. Finding something early could add decades to your life. The benefits pretty clearly outweigh the risks, but at 70 plus, things are different. A lot of cancers grow so slowly that you'd be far more likely to die with them, not from them. Your body's more fragile, so aggressive treatments are way riskier. And suddenly, that whole cascade effect we just talked about can do a lot more real, actual harm than the condition it was supposed to find.
So, keeping all that in mind, Dr. Harove points to 5 specific tests where this new screening math really comes into play. Let's look at the evidence and the real-life stories for each one. We'll start with a test that, for many people, is just seen as a standard part of getting older.
First on the list, the routine colonoscopy. Dr. Harove shares this story about Margaret, a super sharp 78-year-old who walked 2 miles every single day. Her doctor insisted on a routine colonoscopy. Now, she felt totally fine, but she trusted her doctor. Just the bowel prep, not even the procedure, just the prep made her so severely dehydrated that she fainted and wound up in the emergency room with a heart arrhythmia. And the risks don't stop there. The procedure itself, for this age group, carries about a 1 in 500 risk of perforating the bowel. Now, that might sound like a small number, but a bowel perforation for an older adult is a massive medical emergency. We're talking emergency surgery, a potential colostomy bag, and a long, painful, and difficult recovery.
So here's the bottom line. The official recommendation from the U.S. Preventive Services Task Force, the USPSTF, is actually against routine screening after age 75 for average-risk adults. It's just not worth it. The potential harms start to eclipse the potential benefits. A much, much safer alternative to talk to your doctor about is a simple, non-invasive annual stool test.
Okay, next up we've got 2 screenings that are super common and pretty controversial. We're talking about mammograms and PSA tests for prostate cancer. The problem here isn't necessarily the screening itself, but something Dr. Harve calls overdiagnosis. He tells the story of Gerald, an 81-year-old retired teacher. His PSA test was just slightly elevated. That one number led to a biopsy, then surgery, and then lifelong incontinence, all for a cancer that, in all likelihood, never would have caused him a single problem.
And this is a truly staggering statistic. Research from the New England Journal of Medicine suggests that up to 40%, almost half of breast cancers found by mammograms in women over 70 are these super slow-growing types that would never have caused any symptoms. But here's the thing. Once you find it, the whole treatment machine kicks into gear, whether it's necessary or not.
And that's really the heart of the issue. Overdiagnosis almost always leads to overtreatment. And you're putting a more fragile body through biopsies, surgery, radiation, things that have awful, life-altering side effects, all for a cancer that might have just sat there harmlessly for the rest of a person's life.
Okay, this next one is so important because it sounds completely harmless. A routine cardiac stress test, just to check on your heart. But the key phrase, the most important part, is without symptoms. If you are not having chest pain, if you're not having shortness of breath, this test can open up a real Pandora's box.
So what's the problem? Well, it's the incredibly high rate of false positives.
In some groups of people who have no symptoms, the false positive rate can be as high as 40%. That means the test rings a huge alarm bell that something might be wrong, when in reality, your heart is perfectly fine. But, of course, that false alarm is what kicks off the cascade.
So that false positive leads directly to an invasive cardiac catheterization, which has very real risks, like bleeding or even causing a heart attack or stroke. And if they find a blockage, which lots of people have, you might get a stent. But get this, major studies have shown that for stable patients, stents often don't prevent heart attacks or extend your life any more than just taking medication. You go through all of that for no real benefit.
All right, on to number 4, routine bone density scans. Now, obviously, preventing falls and fractures is a huge deal for older adults, but the standard response to a scan that shows low bone density, well, that's where things get a little ironic. Doctors will almost always prescribe drugs called bisphosphonates.
And here is the irony. Using these drugs long-term is linked to a rare but incredibly serious side effect: atypical fractures of the femur. That's right, the very bone you're trying to protect can snap. These drugs can also cause severe jaw problems. And meanwhile, you know what the single most effective way to prevent fractures is? It's not a pill. It's fall prevention. Simple things like balance exercises, getting rid of throw rugs, checking your vision. They're proven to work better, and they have zero side effects.
So our final test is just a powerful example of good intentions that can go horribly wrong. It's an ultrasound of your neck arteries to look for blockages that could theoretically cause a stroke. Take the tragic story of Robert. He was 79, had the screening, they found a blockage and recommended surgery. He walked into that operation talking and totally independent. He came out with a massive, debilitating stroke that left him unable to speak.
Why did that happen? Because the surgery itself, the fix, carries a 2 to 3% risk of causing a stroke in a patient who has no symptoms, the very catastrophe it's supposed to prevent. And for older adults, that risk can be even higher.
So the bottom line here is crystal clear, and it's backed up again by the USPSTF. They recommend against this type of routine screening in adults without symptoms, plain and simple. The potential harm from the fix is often way greater than the risk from the silent blockage they happen to find.
Okay, I know that was a lot of pretty heavy, cautionary information, but the goal here is not to scare you away from your doctor. It's to empower you. So Dr. Hargrove came up with a simple tool that you can use at your very next appointment. He calls it the Empowerment Protocol.
These are the 4 simple questions to ask before you agree to any recommended routine test. Number 1, what happens if you find something? Number 2, what are the treatment risks at my age? 3, what happens if I do nothing? And 4, is there a less invasive way? You see, these questions shift the whole conversation. They force a real discussion about that cascade effect, about the risks, and about what really matters to your quality of life.
And I absolutely cannot stress this part enough. Everything we've talked about today is for routine screening in people who feel perfectly fine. If you have symptoms, if you have chest pain, if you find a lump, if you see blood in your stool, any sudden weakness, that changes the entire game. In those cases, you absolutely need to get checked out. This is about questioning the just-in-case tests, not about ignoring real health problems.
So the next time a routine test is on the table, this is the question to ask yourself. Is this really a tool for my health, or could it be the first step in a dangerous cascade? Remember, you have the right to understand the risks, you have the right to ask these questions, and you have the right to make the choice that is best for your body and for your life. Because at the end of the day, the goal isn't just to live longer, it's to live better.